The first test that was developed in breast cancer, the MammaPrint, just look at untreated node negative and negative and ER positive patient to address the issue of which of these patients have a residual risk without any adjuvant treatment. And at that time, this seems a very important question, and it is. But by the practical point of view, the real issue, if we want to decide about the addition of the chemo, is which are the patients that have a low risk when they receive endocrine treatment, and not when they don't receive any treatment. Because the majority, for instance, of ER-positive patients, they are going to receive endocrine treatment anyway. So, for instance, again, the Oncotype DX, when was developed just in ER-positive patients treated with tamoxifen. And that allowed the test to be developed really to define the risk that is residual after or considering the benefit of the endocrine treatment itself. And this, of course, make a difference in the development and in the results of the test themselves. This is a very important issue about the biomarker. So when we adopt a biomarker, we really want to know which is the intended use of the marker. So which is the clinical answer that we want to have resolved by using the biomarker. And according to this information, the trial that developed the test should be consistent. To give you an example, if the development of a test is in a population that is completely untreated, as I mentioned before, I can identify a population with a very low risk of relapse. And of course, just because of this risk, this population currently should not receive any chemo. But there is a population that is considered at high risk without any endocrine treatment that is not really at high risk because it's cured by tamoxifen or endocrine treatment alone. So in that context, a test that was developed and proved to be effective in a population that is actually treated with endocrine treatment will make the doctor and the patient more confident that the decision of add chemo is more consistent to the real intended use of the biomarker.